Looking at Enterobacteriaceae. Okay, Enterobacteriaceae is family under the order Enterobacteriales. And the first, so the family Enterobacteriaceae. Okay, so from the name itself, enteric bacteria, facultative anaerobic gram-negative rods that live in the intestinal tracts of animals. So mostly catalase positive because they are facultative anaerobic, so they have to be able to survive in aerobic conditions. So that's why they have catalase. Oxidase negative, and they ferment glucose with acid or acid. So this is very important. Catalase positive, oxidase negative. To differentiate the oxidase positive, Pseudomonasaceae and also Vibranaceae, the other families that have oxidase positive. Okay, then grow well on artificial media. So they are the most significant contributor to intestinal infections. 37 genera with hundreds of species, and most important characteristic is the ability to break down lactose. That's why you find that most of the initial media for isolation, your McConkey, EMB, all these media will have lactose as sugar to differentiate between lactose fermenter and non-lactose fermenter. So 37 genera, all culturable. They all can be cultured. So intestinal infections, mostly symptoms will be diarrhea, stomach ache, So when you have diarrhea, stomach ache, persistent, the sample will be as a stool sample. Okay, so as a microbiologist, you are expected to process stool samples. Okay, so the first bacteria we'll be talking about is Escherichia coli. Okay, so you know that the species is Escherichia coli. Serova, when you have variety and types. Serova means the typing is done by serology, H typing. Strains are usually at your laboratory level. Like when you first isolate your bacteria, you have a specific label, whether it's from Watson, Bocklang, you label it yourself. So that is your strain. Okay, that's to help you know where it is from. So first described in 1885 by Theodore Escherichia. And so he found it and he described it. Okay, he first named it as Bacterium coli. So there's a bacteria that lives in the intestinal tract, Bacterium coli. So, but now it's known as Escherichia coli, so named in its honor. So it's a natural habitat of intestinal tract, also considered an indicator for fecal pollution contamination. So it's very important in water microbiology, where they use it to indicate fecal pollution. Okay, I mentioned fecal pollution. So because like in the seas, because E. coli don't survive well in the seas, if you are able to detect E. coli in the seas, that means there is fresh fecal pollution. Okay? So the most frequent causative pathogen in human bacterial infection. So that's why a lot of samples in the hospitals, a lot of the initial screening, you'll see a McConkey plate. Okay, so that is how important all this Enterobacteriaceae is, okay, for the initial screening. So the entire DNA base has been known since 1997. It's a laboratory pet. So most of the biochemistry pathways, most of the molecular biology discoveries initially was done from work done in E. coli, Escherichia coli, because it's so easy to grow, so easy to extract the DNA, so it's easy to work with. It's important as pathogens in urinary tract infections, neonatal meningitis, and gastroenteritis. Okay. So, urinary tract infection, uropathogenic E. coli, UPEC, causes 90% of urinary tract infection, urethritis, cystitis, and erythrocystitis. So urethritis is inflammation of the urethra. Urethra is here. Okay. So it's after the bladder. Okay, after the urinary bladder. So usually inflammation, painful urination is also so dysuria is also another term for painful urination. Urea. So cystitis is usually the bladder inflammation, and then the pyelonephritis is the inflammation here. Okay, at the upper part, just near the kidney. So for any of this infection to occur, there are certain things that the bacteria must be able to. So the bacteria must first be able to. So entry. So entry could be just by simple cut. Okay. If it's superficial cut, it's not that dangerous. It's usually deep cuts. That's where danger from bacterial infection. It has to be deep cuts, not superficial cuts. Okay, so that's what we call virulence determinants. Okay, characteristics that are in the bacteria that allows it to be virulent. Okay, whether it's fimbriae or siderophore capsules, capsular antigens. Okay, so for UPEC, the sample is urine. Okay, urine sample. The determination whether there's infection or no infection is by the number of bacteria you can isolate from the urine sample. Okay, so usually we have a calibrated 1 microliter loop. Okay, this is a calibrated loop which you can buy. It's available commercially. It is usually made from platinum. It's a calibrated loop, which means when you dip the loop into the urine, there's 1 microliter. So urine is supposed to be sterile. If you're healthy, it's supposed to be sterile. However, a lot of times the collection of the sample, there's skin contamination. Although we tell the patient to collect it midstream. Okay, you'll find that you have to tell them collect it midstream. So middle of your urination, you collect. Okay. Okay. So that's why urine samples have to be fresh. Cannot be left overnight. If there's any contamination, the bacteria will grow and you get very strange results. Cysteine, lactose, electrolyte deficient agar. So this is a special agar for urine samples. This is because another important pathogen for UTI, urinary tract infection, is Proteus vulgaris. And this bacteria has a tendency to swarms out. But when its growth characteristics is like this, cannot enumerate it. There's no way you can count it. So it's pointless. And if it's together with E. coli, it will cover. So you can't get good counts. You cannot get good reliable estimates. That's why, but it doesn't swarm unclad because it is electrolyte deficient. Somehow the electrolyte in the agar allows it to swarm. So this media, Proteus vulgaris, doesn't swarm on this media. That's why this media is recommended. Infection is not because they want to, but because they are there and the conditions are favorable. A lot of times they happen to be there. Okay, so E. coli now represents 15% of all nosocomial sepsis. Nosocomial is another term for hospital-acquired infections. Meninges area. So meninges is the membranes that cover the envelopes the central nervous system. So infection of the meninges. Okay, infection of the meninges is called meningitis. You have different bacteria that can cause meningitis. So E. coli is one of them. So usually it infects the infants and elderly, those that are susceptible. Okay, intestinal disease. So there are 6 types here: enterotoxigenic, enteroinvasive, enteropathogenic, enteroaggregative, enterohemorrhagic, diffusely adhering E. coli. When you talk about gastrointestinal diseases, you need to know that you have your small intestine, your duodenum, jejunum, and ileum, and then your large intestine. Okay. Some bacteria focuses on the large intestines, some bacteria focus on the small intestine. Okay, so there are differences. So ETEC, traveler's diarrhea. Because if you look at the infective dose, which means the amount of bacteria before your symptoms occur, okay, you need to consume about more than 1 million E. coli. So the symptom is 5 to 36 hours after ingestion. So when you talk about gastrointestinal diseases, you have to know the symptoms. So for traveler's diarrhea, it's mild. It can be mild. Also, massive watery diarrhea without fever, without inflammation. So the diarrhea lasts 3 to 5 days. Okay. Self-limiting. Self-limiting means even if you don't take any medicine, just keep yourself hydrated. You will go away. If it's non-bloody means your feces, there's no sign of blood. That means there's no colonic tissue damage. No, the bacteria did not cause any damage to your gastrointestinal tract. Okay, if there's blood, that means there is scarring. The bacteria is invasive, causes damage to your lining. The treatment is oral rehydration. Then the risk of mortality is only for children. Okay.